Idaho Matters podcast is brought to you by St. Luke's On Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on demand care for common ailments such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org. From Boundary to Bear Lake, Fremont to Payette, Oahe to Oneida, there are interesting people, places, and histories in all of Idaho's counties. And Idaho Matters wants to share it with you with stories from all 44 counties that make up the Gem State. Email your ideas to idahomatters@boisestate.edu or use the Talk to Us feature in our app, available on Apple and Android, and tune in each weekday at noon for Idaho Matters. From the studios of Boise State Public Radio News, I'm Gemma Cadet. This is Idaho Matters. The need for mental health services continues to grow all across the country, but especially right here in Idaho. However, one Caldwell program is stepping up to meet that need. West Valley Medical Center is launching a new mental health intensive outpatient program designed for adults who need more support than traditional weekly therapy without requiring inpatient care. So joining us now to talk more about this are Angie Merrill, Chief Nursing Officer of West Valley Medical Center, and Jen Gorder, Director of the Behavioral Health Unit, to share more about what this program is bringing to the community. I want to welcome both of you to the program.
Thank you. Happy to be here.
Yeah, very happy to be here.
Jen, can I start the conversation with you to get us started? What was the motivation behind launching this new program?
Well, we just noticed that there seemed to be a gap within the inpatient and the outpatient services. There is a program that we have that's 20 hours a week, and it's still pretty intense. And so there just was that gap between the 1 hour services, which is outpatient. And so we wanted to bring in a program for the intensive outpatient, which is 9 hours a week. So it still offers the structure, the monitoring, the therapy, but it also allows people to go back into their lives and practice some of these new skills.
And can we talk a little bit more about that gap in that mental health services, Jen? Because were you seeing a lot of that in these patients and thinking to yourself, okay, we need to somehow figure out a better option?
Yeah, so mental health is not a linear experience. So, really, we like to look at things from a continuum. So we have a very intense program, which is your inpatient program where someone needs 24/7 support and structure. And then the other option is a 1 hour outpatient service. So there was just that really big period where people maybe didn't need the inpatient or they weren't severe enough to have the inpatient, but they
Mhm.
needed just a little bit more than a 1 hour program. And so that's where we identified that we really wanted to step in and serve the community with this intensive outpatient program.
Angie, can you describe to us the kind of patient this program is designed for?
So really, those individuals that are in not an acute mental health crisis, so maybe they've need a little bit more than just a weekly therapy session. Um, they come to these classes and they're able to learn different coping skills that help them to continue to keep their jobs and be a support to their family, but at the same time, still hold those jobs outside of coming to these therapies that they come weekly, and really just be able to integrate themselves back into the community after after they've continued and worked through these therapies.
Mhm. So, Angie, it sounds like there's a lot of flexibility built into this program. You mentioned the ability for people to keep their jobs and still participate in this program. Can you talk to us a little bit more about why that flexibility part for this outpatient setting is so important?
Well, it really is, what that individual needs when they're at a hospital and they're hospitalized in our behavioral on a behavioral health unit. They're there. They are, with our staff 24/7, and then when they're able to be discharged, We want them to go out back into the community, to be able to be with their families, to be able to go to work and be in the community and become a community member, and having that opportunity to, do those therapies just that 9 hours a week. Flexibility is so crucial with their stability and their continuing their mental health progress.
And Jen, group therapy plays a large role in this program, is my understanding. So, can you talk to us about these sessions and why they seem to be really effective when it comes to mental health treatment?
Yes. So part of mental health is disconnection and isolation. And so what's really incredible about group therapy is it allows the patients to connect with others. They get to see that they're not the only ones dealing with certain issues, and that really everybody's having very similar concerns. There may be different symptoms, but really, it's really just learning to cope with certain things that life throws at you. And a lot of times people have, their I think of it like a tool belt. So people have a tool belt and they have coping skills that they can pull out of their tool belt. And sometimes we encounter situations where we just need a couple of extra tools. And so the really
Mm.
neat thing about group therapy is people get to share those different tools, and they can share, well, this really worked for me, or this really didn't work for me. And so it really allows the patient to drive their treatment and their therapy, as far as they get to really practice and see what works for them. Because we really dig into the evidence. We like to teach research, or sorry, not teach research, but we really use the evidence-based interventions. And so although
Mhm.
research says that this intervention or this coping skill may work, we really like for the patients to try that. And if it doesn't work, then let's find something else, or if it does work, then let's share that.
So, how has the response been, Angie? Not just from from patients. I'm curious about their response, but maybe even from family members, community members who are seeing the outcomes of this program.
Well, we're in the very beginning stages of it, just opened it the last few weeks. And so
Hmm.
um, but that being said, it is very eye-opening and very reassuring to the patients as well as the families, that that they can come home in the evenings and they can be together with their family and receive that support on the family side, as well as going to work the next day and being able to use
Hmm.
those tools that they've been given at the workplace. And and I will say that we continue to get calls every day, many calls, more frequently, as individuals hear about this program opening up and really looking at, bringing more and more patients onto the service.
So, Angie, is the goal of this program to get people to, I guess, graduate from the program to be able to maybe go back down to that 1 hour a day therapy?
I mean, you could say that it would be absolutely, if somebody does feel like that they no longer need those services. That's a great thing, in that they're able to cope on their own. They're able to integrate themselves into their day-to-day activities without the those therapy support. But at the same time, mental health is a disease. It is something
Hmm.
that is not cured, and individuals may have a relapse and may, stumble a little bit, and they can jump right back into those programs and get the help that they need throughout their whole life.
So, Angie, I want to go back to something that you said about mental health being a disease and that there's not a cure for it. How important is it for the broader community to truly understand that and have that register with us, right? That it's not like a broken arm that you can fix and move on.
Absolutely. It is. I mean, it's something like cardiac disease, or a stroke, or any of those illnesses that an individual may have that just it is something you have to continually seek help for, and to take your medications, to see your providers, and get
Mhm.
that support and services that you need to be healthy, to be able to function and have those be able to participate in those day-to-day activities that we all enjoy and cherish.
Jen, for someone who's interested in participating in the program, how do they get started? I mean, how does this work?
That's a really good question. So we have a dedicated outpatient nurse who can field and triage those calls. So they would just call West Valley, or they would call our outpatient services, and that nurse can talk with them and kind of see what's going on, see what some of their symptoms are, and then they can set up an appointment to get an assessment for that program. Or maybe if that person's just looking for individual therapy, they can then give resources, they can refer them to the different places.
And before we go, Jen, what do you hope the broader impact of this program will be on the West Valley community and the broader, Treasure Valley community?
Well, Gemma, I really appreciate that you asked that question, because really what I'm hoping to do is to destigmatize mental health. There's a huge stigma with mental health that it only happens to certain people or certain kinds of people, and mental health does not discriminate. Mental health happens to everyone, and almost everyone is experiencing it. We just don't talk about it. Like if you think
Mhm.
of, back in the day, they used to put women in inpatient, when they were menstruating. And now 100 years later, we balk at that. And so I think just talking about it and being able to normalize it and to really provide skills and education so that we can all just connect and like Angie said, do those things that we cherish and those things that we love.
Well, I want to thank both of you so much for coming in and talking to us about this program. It is just so needed. So, thank you for the work that you do as well. We've been speaking with Angie Merrill, Chief Nursing Officer of West Valley Medical Center, as well as Jen Gorder, Director of the Behavioral Health Unit. We've been discussing the new mental health outpatient program that is in Caldwell right now at West Valley Medical Center. I'm Gemma Gaudette, and this is Idaho Matters.